Hello, my name is Valerie Ling. I'm a clinical psychologist with the Center for Effective Living. I'm sitting outside. I'm actually at home. This is the new way of connecting. I've just watched an episode of The Voice where it was all about how you actually connecting with the people out there. So we must not be dinosaurs. We must grab the opportunities that come before us, and one such thing is doing something like this, a Facebook video. I'm not sure what my neighbors think about me talking to myself like this, but we'll just keep going. So the Center for Effective Living is a group psychology practice that actually began in the suburb of Wesley. I think in 2013 it was just me, and we currently have a plant, a second location, which is in the Hills area of Bella Vista. And I also do various consulting work that takes me beyond just the clinic rooms and takes me into the wider areas of Sydney. So today my video is just to answer, I think, 3 of the most common questions I get asked as a psychologist, professionally and personally. And I thought this might be a sneak into the mind of a psychologist, if you like, if you've always wondered yourself these 3 things. So the first, oh, that's my dog. The first question is, what is the difference between a psychiatrist and a psychologist? Well, the simple answer to that is that a psychiatrist is a medical doctor. And so they are the ones who deal with mental illnesses and mental health issues in the medical domain, and they are the ones that prescribe medication. Psychologists don't. Psychologists work with talk therapy, but doesn't mean that you're just sitting down to have a chat with us like friends. Our training, because we are a registered and legislated profession, what we do actually has to be based on what we call evidence-based practice. So once we've had a talk with you and we've gathered some of the symptoms and some of the experiences that you might be having, we then have to map that onto a broad understanding of what that could be. Is it an anxiety disorder? What kind of anxiety disorder? Is it a depressive episode? Is it recurrent? What is the severity of it? And from there, we are actually then required to dig into our training and what the evidence or the research tells us would be the best way forward in terms of the strategies that we use, in terms of the pacing that we take, even down to the kind of sessions that we might construct with you. So that's the first question, is what is the difference between a psychiatrist and a psychologist? The second most common question I get, and this is personally, usually, is I get asked whether I can read minds. And the answer is no, I cannot read minds. That is not what I have been trained to do. What we are trained to do, however, is to actually understand the whole person in the whole developmental span. So from child to adolescent to adulthood to late adulthood. And then from there, so the cognitive, the physical, the emotional development that happens in each of those seasons in life. And then we're also trained to then work with, assess, and facilitate growth and health in the various systems that come with those seasons of life. So the attachment between a baby and their parent to begin with, and then with peers, and then at school, and then at work, and they're in their relationships, all the way to end season of life issues such as grief and loss. So that's another layer. And then the third layer, as a clinical psychologist, we are also trained to assess and treat mental illnesses, the kinds of things that someone experiences that is actually causing symptomatic dysfunction in their life and in their world. You might experience panic attacks, for example, from an anxiety disorder, or you might have debilitating bouts of low mood that you're finding it very difficult to wake up, feelings of hopelessness, or you might even have a period of feeling the baby blues a lot longer than you're watching some of your other friends after they've had babies. So a psychologist doesn't read minds. We've basically been trained to calibrate our assessment and our formulation of what we're hearing with our client within an evidence and research base, as well as a whole lifespan understanding of what the average individual might experience when they go through difficulties. And the third question I'm often asked is it really difficult to be a psychologist? And this sometimes comes from clients who worry for me that they're being a burden on me. And the answer to that is actually it's a real privilege for us. If you ever get a group of psychologists together, we will tell you how much our clients actually encourage us, how much their strength in the midst of weakness inspires us. I remember being in high school. I don't think I knew I was going to be a psychologist, but I think I've always been interested in people. And I was chatting with someone on the telephone about something that was going on in their life. And I distinctly remember because this person actually reminded me some years after that about what I had said to them. And after they had talked to me about what they were going through, I actually said, you know what? I can't wait to see what the next chapter in your life is like, and I hope I'm around to see how the book finishes even. And I think that's what it's like for me, and probably for most of my colleagues, is we're just so interested and so I think engaged in each person's story. It's unique, it's real, it's authentic. And there comes a point when if we're sitting down with our client, we're actually reading their life story, and then we're joining with them to start to figure out those small but important steps towards the next chapter. What's that going to look like? What's that going to look like for you? And being able to say, you're not alone writing this. Okay, we're doing this together. So no, it's not a burden. I'm often come back feeling so grateful and so privileged to actually being able to walk that path with the day's clients that I've actually had. So those are my 3 questions that I thought I would share with you, and that's all I think I will say today. So leaving you with that and wishing you all the best, and that you will have continue to have a restful and meaningful day. Bye.